Hi, my name is William. I'm a blood cancer patient. This channel is all about my experience as one of the first people to be treated with a combination of two different drugs, Ibrutinib and Venetoclax, as a first-line treatment for CLL/SLL. Can I say right at the beginning, I'm not a doctor. I'm not a medical professional. This channel is all about my experience as a patient. This channel is dedicated to my spouse, who's been hugely helpful during my journey with CLL, to my fellow CLL patients, to the families of those patients, to the doctors, the nurses, the hospital assistants, the clinical staff, the admin assistants at the various different hospitals who treat people with CLL, to the very brave patients with CLL who are involved in trials for new drugs for CLL, and to the medical professionals and students who are thinking about devoting their careers to finding a cure for CLL. CLL is a journey, not a destination. I'd also like to express my sincere thanks and huge gratitude to John Gribben and to the team at the London Clinic, who were absolutely fantastic in helping me on this journey. Hi, and welcome to my video on the wonder drug Ibrutinib. Today I'm going to talk about 5 things about Ibrutinib. First of all, what is it? Well, it's targeted therapy which is designed for CLL. It's a pill. You take it once a day, 420 milligrams, just one pill, with a glass of water. You can live a normal life with CLL and taking Ibrutinib. For traveling, I would always recommend that you put it in hand luggage, never in your case. So I started taking Ibrutinib at 5 o'clock in the afternoon. You're supposed to take it at the same time every day. And to be quite honest, I initially took it at 5 o'clock because that was the time I actually got it at the hospital for the first occasion. But as time went on, I found that actually you can forget to take the pill if you're trying to take it at 5 o'clock in the day. And it was much better and more beneficial for me to take it in the morning when I took my other pills. You can take it with or without food. And if you are taking it with food, Greek yogurt, I found, is extremely helpful and beneficial to just ease out the lining on the stomach. One of the things you have to be careful about with Ibrutinib as a side effect is you can have some fatigue, and you can also have what's called atrial fibrillation, just palpitations in the heart. If that happens, please contact your doctor as soon as possible. There's some fantastic medical assistance that's available. It only happens for a very small percentage of people who have it. I did have some palpitations, and I was able to get some treatment for that with no problem whatsoever. You can drink, for those who like a tipple. On Ibrutinib, you can enjoy alcohol in moderation in terms of that perspective. Now, dental surgery. Ibrutinib is a coagulant. So what I found when I was shaving was that occasionally when I'd nick myself, it could bleed a little bit, and you just have to be careful about that. 3 days before you go and have dental surgery, you need to stop your Ibrutinib. Have the dental surgery, and then 3 days afterwards, you can go back on the Ibrutinib. This is what I was told. I found the hygienist to be no problem with Ibrutinib. All in all, fantastic drug. And the story about how Ibrutinib came to be Ibrutinib is in itself an absolute saga. If you're interested in any of that stuff, there's a book by Nathan Vardi. I have a copy of it right here in front of me. It's called For Blood and Money. It's written by Nathan Vardi, Billionaires, Biotech, and the Quest for a Blockbuster Drug. And it talks about where Ibrutinib came from. It was originally designed, interestingly, for rheumatoid arthritis, but now is a first-line treatment for blood cancer. Ibrutinib is a BTK inhibitor. And let me explain my understanding of this. I'm not a medical professional in any size, shape, form, or description. But if you think about cancer being in a glass, So the liquid in the glass is the cancer. Around that liquid, in the form of a glass in this experiment, is the ecosystem of the cancer. Well, one of those aspects is an enzyme, and the enzyme has a name, BTK. Ibrutinib is an inhibitor for that BTK. And the way I would describe it is it's a bit like having the glass and having a little hole, a tiny microscopic hole in the glass, and the water gradually drains out of your body. And that's literally what happens to the tumors for CLL with Ibrutinib. It debulks the tumor. This is my understanding of it. And therefore, you have to take it at the same time every day. It is an amazing drug. I'm very privileged to have had the opportunity to take it. It has helped several 100,000 people worldwide over the course of the last 10 years. And people really have had the opportunity to continue to live a normal life. And that is the key point I think I want to make about Ibrutinib. It is a normal life with this drug. Thank you so much for looking at the video today. If you like this type of style of video, please hit the thumbs up button. And if you are interested in hearing more about my journey, please subscribe to the channel so that you will get updates when I upload the next video. Thank you. I'd also like to